This is a surgery video for running continuous sutures. So, indications. Skin lacerations extending to the subcutaneous tissues should be considered for closure. Closures decrease the time for wound to heal. They decrease the likelihood of an infection. They also decrease the amount of scar tissue. Closure helps repair the loss of structure, function, or both. It can improve cosmetic appearance and just make sure that your patient presents less than 8 hours after the injury occurred. Contraindications. So wounds that have a high likelihood of contamination, you don't want to suture, you want to leave those open. The presence of foreign bodies, always make sure to get anything foreign out before you suture. Carefully consider extensive wounds that involve tendons, nerves, or arteries. Sometimes you may want to leave those open and not suture those closed. Wound presentation greater than 8 hours after the injury occurred is a contraindication. Advantages and disadvantages. So advantages of this particular suture, the running continuous suture, is that it's quick and it can be applied tightly. Disadvantages include if one loop is broken, then the entire wound may open. You can't just cut one end or partially cut it and allow the wound to be drained. Cosmetically, it's suboptimal. It leaves a railroad track appearance in a scar. So, we've gone over indications, contraindications, advantages, and disadvantages. We've decided to do a running continuous suture. So now, patient preparation. You want to thoroughly inspect the wound, looking for foreign bodies, any debris that may be in the wound. You want to anesthetize the area and irrigate the wound. You want to immunize the patient against tetanus if it's necessary, and you want to select your suture material appropriate to the area. What kind of complications can occur from suturing? An infection can occur, scarring including keloid formation, loss of function and structure, undesirable cosmetic outcome, wound dehiscence, and tetanus. Okay. So after you've done the sutures, what does your patient need to know for follow-up? They need to know to keep the wound clean and dry. A quick shower is okay, but no prolonged soaking of the area. Verbal and written dressing change instructions should be given to the patient, and signs and symptoms of infection. Instructions for when to return to the clinic or the emergency room should be given to the patient as well. Depending on the area, they may need activity restrictions. Analgesics can be given to the patient. Definitely advise them when to return for wound check or suture removal, and advise and educate about scar formation. Okay, so now I have cleaned the wound and anesthetized the patient. I have gloves on, which are not pictured here. I've opened a sterile pack of sutures, and I'm ready to begin. So here is my laceration, and we are going to start by placing a simple stitch to use as an anchor. So I will load my needle here and start at the far side of the wound. With a simple stitch. Lifting up the skin, taking my first bite, straight across to the other, oops, not yet, and straight across to the other side, lifting up the skin, taking a bite, so we'll tie this off using just a regular instrument tie. Now I'm going to reload my needle, and I am going to begin with the first bite that I took using the same location, lifting up on the skin here, going in at a 45-degree angle. My first bite, pulling it through, and taking a second bite. Should come out just down the wound from my other stitch, pulling all the way through here.
I'm going to reload my needle and come straight across the wound. Angle out at 45 degrees. And take a bite. I'm going to continue in this motion until I have the wound fully closed. You can pause it.
So I have continued down the wound. I'm at the end of the wound and I'm going to tie off the suture. So I'm going to do my last stitch here. And I'm going to leave this loop and not pull it all the way taut because I'm going to use this loop to help tie. And now you just do a normal instrument tie, grabbing the loop to tie off. And that's it.